The Northwest Cancer Centre at the Altnagelvin Hospital brings the best in technology and care to patients requiring chemotherapy, radiotherapy, palliative care and haematology treatments. The team, which will care for you, are highly trained and specialised. You are in good hands on your cancer journey. Jerry arrives at the cancer centre with his daughter Sarah. He has prostate cancer.
Hi there, do you have an appointment today?
Yes.
I'll just take you over to the self-check-in and we will get you checked in.
Friendly volunteers are on hand should you need help with automatic check-in at the kiosks.
Not you sorted now.
Here for an appointment.
Carmel has breast cancer. Receptionist Susan is on hand to help her on arrival.
That's your check done now. If you want to click your wee button letter with you and take a seat over there. Okay. All the best now.
Jerry's treatment will be different from Carmel's. He is met by Lynn, who will carry out an MRI scan.
So Jerry, the first thing that we have to do is a checklist. Go through this little form here. We have to do this with all our MRI patients because we use a large magnet rather than x-rays.
Lynn makes sure it's safe by taking Jerry through a checklist.
And that allows you to contact me.
After the checklisting procedure, Jerry is ready for his MRI scan.
Give you headphones because it is really noisy.
He is given headphones as the scanner is noisy. MRI scans take a minimum of half an hour. Most patients don't experience any side effects other than feeling slightly warmer than usual.
Jerry, we'll start your scan now.
This scan is to check where the cancer is and help the doctor decide how to treat it.
Nice, so just going ahead there.
Following the initial MRI scan with Lynn, Jerry is brought to have a CT scan.
So my name's Avi and I'm one of the CT radiographers and I'm going to be doing your CT scan for you today.
This is to provide further information about how the cancer will be
So
treated.
the scan's only going to take about 5 minutes. If I can ask you now to lie down for me, head on the headdress, feet to the bottom.
While Jerry is undergoing the scan, he is injected with a special dye to highlight tissues and blood vessels, providing the radiologist with high-quality images.
Based on the results of your test, we would recommend 4 weeks of treatment. That's every day, Monday to Friday, for 4 weeks. Treatments will last approximately 2 to 3 minutes.
Dr. Stewart has examined Jerry's scans and pathology report and informs him of the planned treatment. Each patient is given personalised preparation advice before their treatment.
Jerry, are there any questions you want to ask me about the side effects of treatment before you sign your consent form?
Following the consultation with Dr. Stewart, radiographer Lois McGinley explains the preparation and possible side effects again.
It's also part of the treatment that is meant to increase the antibody treatment.
For some patients, it may be necessary to have a mould or a mask made for their head area. This may seem daunting, but is actually a simple, painless process where a warm plastic sheet is placed over your face, and when it cools, it sets into shape.
Wait a couple of minutes for that to cool down, okay? Taking that off for you, alright?
The reason for doing this is so that your head can be in exactly the same position every time you come for treatment.
Just going to take you up a wee bit closer to the machine, all right?
To prepare for radiotherapy, Jerry has to have a special planning CT scan, which is used to plan his radiotherapy treatment.
There's our little lasers that we use for lining you up for treatment, okay?
The two radiographers line Jerry up carefully with the laser lights and make pen marks on his body.
Pop them onto your skin now, okay?
These markings are then made permanent by tattooing, and this ensures that every treatment is always aimed at exactly the same place every
You'll
visit.
move in and out of this machine a couple of times, but we're watching at all times, okay? Back in a moment.
So this patient has already received hormonal therapy and now he's proceeding for radiotherapy.
Following consultation and scans, the cancer specialists study your case and develop the best treatment plan specifically for you, so tailored treatment can be scheduled. This room houses the linear accelerator, or LINAC machine. Aligning Jerry's tattoos to the laser lights, the radiographers position Jerry precisely so the X-ray beams target the cancer.
Okay, happy enough there?
Although the radiographers leave the room during your treatment, they monitor you on CCTV cameras all the time. The beams from the LINAC machine cannot be seen or felt.
Okay, well done, Jerry. It's your last.
After Jerry's last radiotherapy session, he meets Dr. Stewart.
You've had very minimal side effects, just a little bit of tiredness. I'd expect that to improve and go away completely over the next.
Patients are seen in their last week of treatment to review their side effects and to arrange future follow-up appointments.
We'd check your PSA again, and I would like it checked once more before you come back and see us in 6 weeks' time.
Dr. Dasgupta meets Carmel and brings her to her consultation room to clinically assess her. Carmel's treatment is chemotherapy, and Dr. Dasgupta explains the scans and what treatment lies ahead.
Can you see? So these are the long bones of your body. These are the ribs. Chemotherapy will be able to control and treat the disease.
What I'm going to do today is just go through your initial nursing assessment and ask you some questions.
For Carmel, her treatment means visiting the Sperrin Suite over a 10-week period.
And what to do if you get any side effects. Right. I'll also give you a wee thermometer today to take home with you.
But first she has to have a short meeting with the pre-assessment nurse, who advises her on what to expect throughout the treatment and gives her a helpline number and other contact numbers for the hospital should she need them.
It's also important that you eat safely whenever you're on this treatment, Carmel. Alright? So I'll give you a wee bit of information on that.
First of all, I'm going to go through your medications that you take at home, so the medications prescribed by your GP.
Carmel also meets pharmacist Orla to advise her on her medications.
Paracetamol if I have pain.
So you just take that when required?
Yes.
Okay.
And
The pharmacist then explains the various medications she will be offered to avoid side effects.
So the main side effect that we want to prevent is any sickness. So we will give you medication to take home with you to prevent the sickness from happening, okay?
So I am going to wash my hands now, and then we're going to have a look at the veins and put a cannula in for the chemotherapy, okay?
At the Sperrin Suite, Carmel is prepared for a drip which contains the chemotherapy solution. Most patients receive the chemotherapy as an outpatient. This is administered while sitting on a comfortable chair.
Full name, please.
Elizabeth Carmel McKenna.
Highly trained medical staff are on hand throughout the process.
Okay, Carmel. So I'm going to give you this wee leaflet again, and now we're going to go through all your medicines.
The pharmacist visits Carmel on her first day of chemotherapy to confirm and explain the various medicines which she'll be taking home with her and how to use them.
So this is your anti-sickness medication.
We're just going to do some observations and see how you're feeling at the minute. Is that okay?
Yeah.
Should patients need to be admitted for their treatment or treatment of complications, there is a specialist ward, Ward 50, on the first floor. The Cancer Centre is purpose-built and designed to ensure visits are as comfortable, convenient and stress-free as possible. It has 2 dedicated car parks, one at the main entrance and one underground, which has a lift which brings you straight to the reception area. There is a coffee shop on the ground floor next to the reception. There is also a Macmillan Information and Support area which is available every day.
Do you want me to show you a few wee leaflets? It's over here.
At man times, staff or volunteers provide booklets and leaflets which will signpost you and your family to local support services.
You know, they do have a support programme as well.
Macmillan Cancer Support have also established a support centre in the grounds of Altnagelvin Hospital. Here, patients can relax in a calm atmosphere and talk to staff and volunteers. There is also a range of supporting therapies in the specially designed therapy rooms. The Northwest Cancer Centre is friendly and welcoming. It is equipped with the latest cancer treatment technology and staffed by professionals trained specifically to help patients with cancer.